To the coronavirus, education experts told lawmakers today about remaining struggles for opening schools safely. They say schools don't just educate children, but also provide emotional development, reliable meals, and speech and mental health therapies. They say being away from that can impact a child. But going back to school shouldn't come at the expense of teachers and their families.
Safely and effectively reopening schools is going to take resources. Whether schools begin the year in person, remotely, or a hybrid combination, funding our nation's public schools should not be political. It is an investment in our nation's future success.
They stressed a one-size-fits-all approach will not work, and considerations must be given to things like new outbreaks. New at noon, another 1.4 million Americans filed for first-time unemployment benefits last week. It's the first time initial jobless claims have gone up in nearly 4 months. It comes as some states roll back reopening plans and newly reopened businesses close down again. Well, those new numbers come as Senate Republicans are expected to introduce a $1 trillion stimulus package today. Millions of Americans are set to lose the weekly $600 unemployment benefit. Right now, that is still the biggest sticking point. Republicans are talking about a $200 benefit to replace the current $600 benefits. They also want to send out another $1,200 stimulus check, but there's no word yet on who would receive it. The package also includes $105 billion for schools without tying the funding to in-person learning, something the president has pushed. He has also said he might veto a bill that doesn't include a payroll tax. Majority Leader Mitch McConnell says this is not an extension of the CARES Act.
The legislation that I've begun to sketch out is neither another CARES Act to float the entire economy, nor a typical stimulus bill for a nation that's ready to get back to normal.
Democratic leaders are still unified behind their own $3 trillion HEROES Act that passed the House in May.
The time is so important, and the sooner we can see their bill, the sooner we can understand our differences more clearly or our similarities.
And then start negotiating.
Well, Congress has until August 7th to reach a deal on the new stimulus when members leave for summer recess until September. We are less than a month away from CMS's return to learning, and for the first 2 weeks, everyone will go to school, meet their teachers, get supplies. Then on the third week, they'll begin remote learning. As our Gina Esposito reports, we took parents and teachers' questions directly to Superintendent Ernest Winston.
One of our first questions addressed teacher concerns about returning to school buildings just like this one during remote learning. CMS Superintendent Ernest Winston says that teachers will not be required to go back into the classroom because he understands that some may not feel comfortable. Winston walked us through what families can expect with remote learning. CMS will be using Canvas for checking assignments, due dates, grades, and communication with teachers. For parents who are helping their child with Canvas, there will be support in English and in 5 other languages. You can expect a mix of live and recorded instruction. Information about how testing will work is still to come. This year, grades and attendance will be counted.
We want to be very clear with our students and our families that those are clear expectations going into this school year. That said, I know there will be extenuating circumstances with some families.
Winston says the district is working with community partners to ensure they're checking on students' needs while they're remote, everything from food to technology. For the first 2 weeks in the classroom, he says that staff has been working really hard to clean school buildings to make sure that it's a safe environment. Back to you.
Gina, thank you. Public health experts say they're watching a trend of more young people going to the hospital with COVID-19. In the past 30 days, the Charlotte region saw a 62% jump in COVID-19 hospitalizations, but there's been no major change in available ventilators or ICU beds. Experts say it's because the patients are younger and healthier, have milder symptoms, and are less likely to need ventilators. Novant Health is working to increase bed capacity by 60%. They're hoping for a reversal in recent trends so they don't have to use those beds.